Hi everyone, welcome to this short tutorial from Pathology Made Simple at Pathology. This is the part 3 of tissue repair series. In the part 1, I had discussed about the general aspects of tissue repair, where the repair by regeneration was discussed in great detail. In part 2, repair by connective tissue deposition was discussed in great detail, particularly the angiogenesis and the formation of granulation tissue. In this part, we will take up some specific examples. I will talk about skin wound healing. So in the next 10 to 15 minutes, I'll be talking about healing by first intention, healing by second intention, and then we'll conclude by knowing the various factors which affect the wound healing. So whenever there is a wound on the skin, based on the nature and size of the wound, the skin wounds heals by two processes. Either of these two processes. One, it can be healing by first intention, which is also referred to as primary union, and second is healing by second intention, which is also referred to as secondary union. Okay, so wound healing, what is this primary union and secondary union? If the wound is clean, uninfected, particularly example being surgical incision, which is approximated by surgical sutures, then the healing is referred to as healing by first intention, which basically involves, the injury involves only the epithelial layer. Now healing by second intention occurs whenever there is wound with larger tissue defects, unlike the smaller, clean and uninfected surgical incision which occurs by first intention or primary intention. Now let us quickly recall the steps involved in scar formation, which we had discussed in the earlier videos. Whenever there is injury, the first thing which happens is hemostatic plug, which basically stops bleeding, which provides scaffold for the deposition of fibrin, and then results in inflammatory phase to eliminate the offending agent, which then further progresses towards proliferation of various cell types, being it could be remnants of injured tissue, it could be vascular endothelial cells, which could be fibroblast. All these things were discussed in greater detail in the earlier video. Okay, once the cellular proliferation phase progresses, it results in the formation of granulation tissue, which is very, very important, and finally there is deposition of connective tissue. So whatever, regardless of the site of injury, these are the basic steps which are involved in healing or tissue repair. What are those important steps? One being inflammatory, cellular proliferation, and three, finally healing by deposition of connective tissue. Now let me try to explain how the skin wound heals by primary or and secondary intention by these series of illustrations. So imagine that this is an illustrated image of a skin with epidermis and dermis. Now this is an incision which is clean, uninfected and surgical incision. So that this is just a representation showing a clean uninfected surgical incision, and we know that these types of wounds heals by first intention. Now what happens during this process? The first step, as we know, there is hemostatic plug, which stops bleeding and supports the migrating cells into the injured site. Okay, so initially it is a fibrin clot, isn't it? So next, what happens in the next 24 hours? The inflammation starts, where you know that in the acute phase of inflammation, lots and lots of neutrophils starts coming towards the site of injury. So you see lots of inflammatory cells, particularly neutrophils, towards the site of injury. In this case, injury is a clean surgical incision. Now what happens in the next 24 to 48 hours? Okay, so the basal cells, the mitosis begins to appear, the cells start to proliferate, and then they proliferate and then progress towards one another, and then it forms a thin cover above the dermis. So it just starts approximating and then forms a thin cover above the dermal surface, and then it sort of covers the wound surface. Okay, so this epithelial regeneration covers the wound surface. We know that cell proliferation involves the native epithelial cells, it involves the vascular endothelial cells, and it involves the fibroblasts. This is what we discussed in the last video, right? So the first one is the native epithelial cells. The squamous epithelial cells proliferate, they approximate, and then they form the covering of the wound over the dermis. So then over the next 3 to 7 days, there is formation of granulation tissue. We have discussed in great detail about the process of angiogenesis. So lots and lots of blood vessels starts forming along with deposition of these inflammatory cells, and the mediators released by these inflammatory cells are the ones which are important for this granulation tissue to form, right? So this happens in the first week. So what happens in the subsequent weeks? Subsequent weeks, there is deposition of connective tissue. The epithelial regeneration is more than what we saw in the first week, right? There is a thin scab above it, and then over a period of time, the granulation tissue, which was highly vascular, diminishes its vascularity. Then the fibroblast starts proliferating, laying down of collagen starts. So this is what happens in the next 2 to 3 weeks. So finally, at the end of 1 month or 4 weeks, there is clear-cut deposition of connective tissue in the form of scar. The cells become less in number, more and more of collagen is being laid, and this collagen is particularly a type 1 collagen. This is a fibrillar collagen which is seen in scars of the wounds. So this is what happens in healing by first intention. You can easily make out that the scar is not really very thick. It's a very thin scar, and then the epithelium has completely regenerated. Okay, so that is how wound heals by first intention when it is clean and uninfected. Now let us understand the same mechanism if this is a large defect. So this is referred to as wound healing by secondary intention or second intention, where the injury is bigger, larger and wider defects. Okay, it is filled with necrotic debris and inflammation. Initially, as we saw earlier, hemostatic plug, which is fibrin plug. Again, lots and lots of inflammatory cells. Larger the blood clot, larger the wound defect, more the number of inflammatory cells also accumulate. Okay, so even the inflammatory phase, there will be too much of inflammatory cells, and then the proliferation also too much. As in the primary intention, what we saw, it starts proliferating, migrating towards one another, approximating, and then it sorts of covers. But of course, this might take more time. If there is infection, ongoing infection, then this process might be delayed. We'll talk about factors affecting wound healing later. Okay, so the larger defects have larger granulation tissue. So large amounts of granulation tissue forms in the same 3 to 7 days if it is not infected, if the wound is not infected. Okay, look at this. The cell proliferation begins and you have a thick scab there, and in the next 2 to 3 weeks, just like what we saw in primary intention, larger proliferation of fibroblast, laying down of collagen, and then this collagen is too much because bigger scar as compared to that of wound healing by primary intention. And in the next 2 to 3 weeks after formation of scar, some of these fibroblasts assume the responsibility of being contractile. They are now referred to as myofibroblasts. Okay, they start contracting the wound. So that is what is called as wound contraction. You can easily make out that there is depression on the surface of the wound. Okay, so this is what happens in wound healing by secondary intention. The collagen is the same, type 1 collagen or fibrillar collagen. Now we will just see a side by side what happens in each of these phases. First intention and second intention. Clean scar, larger defects. Okay, hemostatic plug both sides, fibrin plug. Inflammatory cells, look at the amount of inflammatory cells. Less number of inflammatory cells here. Too many inflammatory cells. Granulation tissue, larger granulation tissue, more fibroblast proliferation in secondary intention, and the bigger scar. This is what happens in, these are basically differences between wound healing by first intention and wound healing by secondary intention. The most important being a bigger scar and then wound contraction. Okay, a depressed scar or the contracted wound in secondary intention. Now let us understand what happens to the wound strength. Let us see if the normal tensile strength is regained after a wound. Absolutely no. What happens, at the end of first week, only 10% of that of normal. The wound strength will be only 10% that of the normal, which rapidly increases over the next 4 weeks and then it slows down. At the end of 3 months, the wound strength will be a maximum of 70 to 80% that of normal. No wound can achieve 100% normal tensile strength. Okay, so the maximum the wound strength which can be achieved is 70 to 80%. Now moving on to the next important part of this talk, the factors affecting wound healing. Okay, so there are lots and lots of factors which affects the wound healing, which affects the outcome of a given wound. So these factors can be broadly categorized into local factors and systemic factors. Let us understand this one by one. Now coming to local factors, The most important factor which results in delay of wound healing is infection. So whenever there is persistent infection, we all know that persistent infection results in persistent inflammation, and that results in delay in wound healing. Apart from persistent inflammation, there is the injury is itself persistent. So that's the reason why there is delay in wound healing, particularly whenever there is infection. The second important thing is location. The location of wound is particularly over the joints, okay, where the mobility can't be restricted, okay, so that if there is more and more mobility, the delay in wound healing is more. So when we talk about mechanical factors, any movement over the wound surface, that sort of results in hindering of the normal repair process. The vessels might get compressed, okay, the wound edges might get separated, and that results in delay in wound healing. So type of wound, if it is a small surgical incision, it heals faster, it heals by primary intention. If this is a wound caused by blunt trauma, which are large excisional wounds, that heals by secondary intention, right? So the next important local factor being blood supply. Wounds which have adequate blood supply heals faster. It's common sense, right? Wounds which have poor blood supply do not heal faster. Particularly when you have a patient with atherosclerosis, when you have a patient with compromised blood supply, okay, so these are the patients where wound healing might be delayed. Next one being radiation. Ionizing radiations decreases the whole repair process. So moving on to the systemic factors, age. Age is one of the important systemic factor where wound healing is quite rapid, very rapid in younger individuals as compared to that of elderly individuals. The nutritional status is another important systemic factor which can result in delayed wound healing. For example, if the patient is suffering from nutritional deficiency of vitamin C. Vitamin C is important for the collagen synthesis. Okay, so when you have a deficient vitamin C, that might result in inhibiting the collagen synthesis, and that can retard wound healing. Patients with malnutrition also have lots of protein deficiency, and that can result in delay in wound healing. Diabetes is one of the most important systemic factor which can result in delay in wound healing. There are so many causes where it can result in impaired wound healing. One of the most important cause being microangiopathy. Okay, we will discuss in detail about how diabetes and how microangiopathy results in all the problems which can occur in diabetes. One of the thing is delay in wound healing. So now, as of now, remember that diabetes patients will have retarded or delayed wound healing. The next important systemic factor being, supplementation of glucocorticoids. What happens, sometimes they give steroids. So the most important thing is that these steroids inhibit TGF beta. We have studied about TGF beta in the earlier videos, that is very important for healing by connective tissue deposition. They are the ones which stimulates fibroblast to synthesize collagen. Okay, so there is decreased fibrosis. So that means the wound healing might not be proper if there is glucocorticoid supplementation in these cases. Hematological abnormalities is one of the systemic factor which might result in impaired wound healing, particularly in cases where there is deficiency or quantitative deficiencies of neutrophils. We know that neutrophils are one of the most important cellular component which appears during the initial stage of wound healing, right? So whenever there is defect in the number and quality of neutrophils, that itself can result in further delay in the subsequent processes, which can result in delayed wound healing. So these are some of the important factors which affects wound healing. The infection, the location of wound, mechanical factors, size and type of wound, the blood supply, radiation are all included under local factors, whereas the nutritional status, diabetes, glucocorticoids, hematologic abnormalities and age being in systemic factors. So this is all in this video. We have discussed in detail about healing by first intention, healing by second intention, and touched upon some factors which affect wound healing. Thank you for watching. Please hit the like button if you have liked this video, and then do comment, do subscribe. Don't forget to share if you find this video and the whole series of tissue repair you find if it is useful. Thank you.